This is Kathy Knipfer, instructor for Nursing 2313, recording the community-based nursing lecture for Chapter 12, Home Health Care Nursing. Historical perspective of home care. The way it's practiced today, it's a relatively new phenomenon, but providing care in the home is an old concept. Florence Nightingale was credited with developing the concept. Lillian Wald and Mary Brewster established home nursing in the United States. This led to the New York City Visiting Nurses Association, or VNA. Modern care evolved from the VNA to a medical model alternative to extended care. It became a cost containment strategy. So let's talk about the significance of home health care. The goal is to provide services to individuals and families and to promote, maintain, and restore health. This goal is achieved through short-term, intermittent, direct nursing care made in home visits. Home care nurses provide direct services or supervise direct services. They also teach clients, families, and caregivers how to provide self-care, and they use communication skills to enhance continuity of care. The majority of clients are older than 65, are recently discharged from acute care, or they have diagnoses related to circulatory system issues. There are several different kinds of agencies that provide home care. Official home care agencies only provide services certified by federal mandates. Hospital-based agencies choose what services they offer. They may provide Medicare and Medicaid if they're certified. Proprietary agencies are for-profit and provide services based on third-party reimbursement or self-pay. They may provide Medicare, Medicaid if they're certified. Private duty agencies primarily provide shift relief at institutions or for private clients. Services are often by paraprofessionals such as aides and homemakers and also nurses. Three key components of home health care are home care agencies, home care equipment vendors, and home infusion therapy companies. So let's talk about the breakdown of sources of payment for home care. Medicare is the single largest payer of home care services at 41%. Medicaid is the second largest at 24%. State and local governments pay for 15%. Private insurance companies pay 8% of home care expenditures. And then 10% are attributed to out-of-pocket expenses that are paid by clients. And then there are other sources, which would be 2%. When we compare acute care nursing to home care nursing, we know that the environment or location of the care is different. In home care, the nurse is a guest in the client's home, whereas in the hospital or clinic, the nurse is in control. The need to be flexible and adaptable is essential because the home care nurse may visit many different home settings. Hospitals recruit new graduates. Home care agencies normally hire only experienced nurses because of the need to be self-reliant and an autonomous decision maker. Home care does not have the cadre of professionals for backup in the case of an emergency. The home care nurse must be competent in developing the client and family's efficacy regarding self-care. Charting is different in home care as reimbursement often drives documentation. The nurse-client relationship is also different as the home care nurse may care for clients over an extended period of time. This allows for the development of a therapeutic relationship that is built on trust and caring. The type and amount of family involvement vary by the setting. Outcomes are short-term in acute care and more long-term in home care. Advantages of home health care include lower costs, a less threatening, familiar comfort of home that enhances care and quality of life. It allows for easier access to loved ones and their support. Clients are taught self-care that impacts their quality of life. It decreases the burden on the family and family stress. It contributes to restoration of the family. and allows for personalization of health education. There's also a higher job satisfaction for nurses. Challenges to home health care include the stress caused by multiple unfamiliar professionals in the home. It may be considered an intrusion on family privacy, an interruption of family routine, or a loss of control. There may be personality conflicts with staff or concerns regarding staff competency. There may be an impact of the care on siblings or a child. There may be out of pocket expenses. There may be extra paperwork and documentation, and then there also might be nurse issues such as job stress, workload, pay, and benefits. Nursing skills and competencies include promptness. Nursing competency and knowledge base is important. Effective communication is important with the client and family to promote trust. The nurse must know about disease management, treatments, and medication when they do health teaching. The nurse must provide case management and be familiar with available community resources. The nurse must be competent to provide physical care and to provide delegated medical functions. So let's move on to the home visit. So all nurses who work in the community should master the competencies for home visits. So there's a certain degree of preparation that's required to make a home visit. You need some basic supplies and equipment. So on page 351 you see box 12.2, which include the basic supplies and equipment. The supplies generally include hand washing equipment, assessment equipment, treatment supplies such as dressing, sterile and clean gloves, tape, alcohol swabs, occupational health and safety supplies such as eye shields, masks, aprons, gloves, and then printed materials such as a map, agency forms, business cards, and also laboratory supplies. When beginning the visit, introductions should take place. After the introductions, the visit usually begins with a short period of casual social conversation. This puts the client and family at ease. During the initial interview, the nurse outlines a contract stating the purpose of the visit. The nurse would perform a physical assessment. The nurse would assess the family and also complete a financial assessment. Oasis C is currently being used. Certain things were added in 2010 to the basic Oasis. Measures were added such as administration of vaccinations, standardized pain assessment, pressure ulcer risk assessment, fall risk assessment, a depression screen, medication management and education, inclusion of specific best practices in the physician ordered plan of care, timely notification to the physician, and implementation of other best practices. When determining needs and planning care, the nurse, client, and family discuss the nursing care plan. The plan is developed collaboratively. They also determine who will be responsible for particular aspects of the care until the next nursing visit. Implementation during the home visit includes physical care, delegated medical functions, teaching, counseling, and referrals, and this is all based on the plan of care. When terminating the visit, the nurse should review the purpose of the visit, outline what was learned from the assessment, review the mutually agreed upon plan of care, and discuss the plan for the next visit. Each visit has specific goals with plans to meet the goals. These goals should be evaluated and followed up. The overall goal is to maximize health functioning and self-care. For documentation, it has to be established that they are homebound and that they need skilled professional nursing care for payment. You can look at box 12-1 for more information on that. You also have to adhere to confidentiality and be focused on patient safety. For your own personal safety, you want to get to know the neighborhood, so you would perform a brief windshield survey. You want to dress in sensible shoes and simple clothes. Avoid long necklaces, expensive jewelry, or pins of religious or political nature. You should know your client. Always note a history of violence and keep your supervisor informed of potential violent situations. Have safety accessories in your car, such as cell phone, flashlight, and keep it well maintained. Make sure your cell phone is charged. Know the agency policies and follow them. Lock up any equipment and valuables in the trunk of your car before leaving the agency or your home. It is so important for the nurse to support the lay caregiver. They are important members of the client's healthcare team. Lay caregiving is one of the world's fastest growing unpaid professions. 80% of home care services are provided by lay caregivers. The stress and demands of caring for a loved one 24 hours a day, 365 days a year take a toll on family caregivers. Caregiving includes providing emotional support, direct health care, financial support, mediating with health and service organizations, as well as sharing a household. Family dynamics vary. The nurse should never be judgmental about choices families make. An important role for the home care nurse is assessment and support of lay caregivers. With caregiver stress, the nurse would see social isolation, decreased preventive care, depression and illness, lack of support, and demands on time and energy. It is important to assess the caregiver. You want to assess caregiver presence, availability, whether assistance is needed, their knowledge, and their physical and psychological status. Interventions for caregivers include enhancing their quality of life, providing adequate preparation for ongoing needs, respite care, reciprocity, communication, education, and support programs. In the future of home care, there's an increased focus on practice. It's increasingly important as a role in the community based care. It focuses on cost containment and advocacy for the client and family. The nurse should be aware of changing regulations regarding coverage and should keep informed on these changes. Nurses will be called on to counsel, teach, act as consultants, as families have increased responsibility for lay caregiving. There is also an increased use of technology. In summary, healthcare and nursing care shifted from home to acute care back to home again. The major roles of home care are to educate, reinforce learning, and encourage clients and families to provide ongoing self care. While disadvantages exist, the advantage to home care far outweigh the disadvantages. Home care is always provided within the context of the client's family and community and follows the principles of continuity of care. Question number 1. How should the nurse begin the home visit? A. By immediately beginning the OASIS assessment. B. With introductions and a short period of casual, social conversation to put the client and family at ease. C. With the completion of a genogram and cultural map. Or D. By determining the lay caregiver relationships and schedule. The answer is B. With introductions and a short period of casual social conversation to put the client and family at ease. The rationale is that in some cultures, the family will place a great deal of weight on getting to know the nurse before they will allow the admission assessment to commence. One nurse who specializes in transcultural home visiting stated, "I know that the family is ready to begin the admission interview when they offer me tea and food. It is important to begin building a trusting relationship from the first greeting. A friendly and warm manner helps as the nurse begins to ask the client questions about specific healthcare needs." Question number 2. A 20-year-old woman is caring for her 5-month-old baby who has frequent episodes of apnea. Immediate action was frequently needed, and on one occasion, CPR was needed to revive the baby. What public health nursing intervention could you use to address the needs of the client and her baby in this situation? A. Health teaching and counseling. B. Screening. C. Collaboration. Or D. Consultation and collaboration. The answer is A. Health teaching and counseling. The rationale is that counseling establishes interpersonal relationships with families or individuals to increase or enhance their capacity for self care and coping. In this case, the family or parent is the client. Health teaching communicates facts, ideas, and skills that change knowledge, attitudes, values, beliefs, behaviors, and practices of individuals and families. Question number 3. The nurse is scheduled to make a home visit to Mr. Jones. Upon arrival to the neighborhood, she has an uncomfortable feeling. The nurse should A. Trust her instincts and defer the appointment until another time. B. Call the police to report her suspicions. C. See the client as scheduled. Or D. Call the client to see if he is okay. The answer is A. Trust her instincts and defer the appointment until another time. The rationale is that home care nurses should pay particular attention to their own personal safety. Assessment of the environment should occur as the nurse enters the neighborhood and trust his or her instincts about safety.